We're now moving on to a panel discussion, and I'm going to read out the panelists before we announce the panel facilitator. Now, first up, from one wahine toa to another, I'm delighted to announce our panel today. We have the wonderful Dame Te Wheeler Percival, who is a New Zealand-born Samoan paediatrician whose family hails from Mofu in Manua and Puapua in Savaii. A distinguished consultant paediatrician and associate professor in the Department of Pediatrics at the University of Auckland, she combines clinical work at Kids First Children's Hospital in South Auckland with groundbreaking research and advocacy for Pacific Health. With over 2 decades of experience in acute and outpatient pediatric care, Dame Te Wheeler specialises in Pacific Health, maternal and child health and child protection, community pediatrics, and disaster medicine. There's a lot more, but she's going to be here very soon. So a round of applause for Dame Te Wheeler Percival. And the list continues of our wonderful wahine toa. Also joining Dame Te Wheeler, nice to see you, my dear, is Pro Vice Chancellor Pacific here at Waipapa Taumatarau, the University of Auckland, New Zealand. Is Jemima Tiatia Siao is a Professor of Pacific Studies at Te Wananga Waipapa, a School of Māori Studies and Pacific Studies, and Pro Vice Chancellor Pacific at Waipapa Taumatarau, University of Auckland. Professor Tiatia Siao is responsible for implementing the university's strategy regarding Pacific staff, students and communities. She plays a critical role in advising the Vice-Chancellor and the senior leadership team on matters concerning the Pacific people's communities and the broader Pacific region. Malo soifua. Round of applause. It gives me time to breathe. All right, and our final panelist, and there will be others as well, is Iono Professor Alec Ekiroma. Iono Professor Aleka Ekiroma is a distinguished Samoan clinician, researcher and health leader, currently serving as the Director General of Health for the Ministry of Health in Samoa. Born and raised in Samoa, he has dedicated his career to advancing Pacific health, medical education and women's reproductive health across the Pacific region and New Zealand. And he's also a very patient man when I always hound him for interviews and whatnot. So please join me in welcoming Iono Professor Alec Ekiroma. Now, our facilitator is Sir Ashley Bloomfield, KNZN. He is a respected New Zealand public health leader, physician and academic, currently serving as the interim chief executive of the Institute of Environmental Science and Research, ESR, in case anyone wanted to know the acronym. In other news, he's also a professor at University of Auckland School of Population Health. Born here in Aotearoa, he has built a distinguished career spanning from clinical medicine, health system leadership, and international public health diplomacy, with a strong commitment to advance evidence-based policy and equitable health outcomes. He joins us right now, but I've said this to him before. The first time I saw him in public, I thought there was going to be a public announcement. No lockdowns here. All right, a round of applause for the facilitator and a wonderful panel. As well as welcoming back to the stage, may I please invite Kere Kere, Associate Professor Donald Wilson, as well as Karina Gray to join our wonderful esteemed panelists. Me taki ma'aka, maururi.
Kia ora koutou katoa. No, not a COVID-19 announcement, even though I'm behind the podium here. What a very distinguished panel we have here. It's a real pleasure to be facilitating it. We've had some excellent, informative and thought-provoking presentations already this morning, and it's great that we've got Donald and Karina up here as part of our panel, along with the 3 others. So what we're going to do in this session, we've got about an hour. I'm going to just give you an outline of the session, make a few opening comments. I'm then going to ask our panellists some questions. And just for our panellists, there are 2. One thing will be similar to the stand-ups in the Beehive, and one thing will be different. The thing that will be different is I will be gently asking you the questions rather than shouting them at you. The thing that will be the same is I will ask you a question, but you've all had media training, so you know that you just give the answer you want to whatever the question is. If you haven't had media training, I'm sure JP can give you mates rates after this. So then we'll do that for about 20 minutes, and then we'd love to involve you. We would like to open it up to the audience to have your questions, and you can direct them at one or other panellist, or we can just go along the panel. But this is your opportunity to ask your best questions, or any question actually, put them on the spot of our panellists while we've got them here. So I'm going to make a few opening comments. I want to start with trust, and I'm going to finish with hope at the end, of course, as we should, before we head off to lunch. But just a word on trust. Trust has been in governments and in media and in institutions generally has been declining in many countries around the world, particularly Western democracies. And we've seen this in New Zealand, and the latest surveys confirm that. However, what hasn't declined in trust, despite the popular myth, is trust in science and scientists has not declined, either in here or globally. And there was a study published in Nature just in January this year, over 70,000 people from 68 countries around the world, and trust in science and scientists was actually quite high. New Zealand was 9th on that list in terms of the level of trust, and this is confirmed by New Zealand-based surveys that show about 75% of people still have a high level of trust in science and in scientists. And if anything, they want scientists to be more involved in policy making, especially around things like introduction of new technologies. So I take some, I'll finish at the end with hope, but there is some hope in that too, because even though we see particularly populist politicians either ignoring science or deliberately trying to undermine trust in science, actually, as we found through COVID here in Aotearoa and in the Pacific, the majority of the population are very discerning. And if you are trustworthy, that is honest, reliable and competent, then people will actually trust you. So I'll start with that. What's happening in science, innovation, technology, research in Aotearoa? Well, Cleona gave a really good overview of some of the things that are happening. Just a couple of observations from me as a chief executive at the moment of a Crown Research Institute that's going to transform over the next year into a public research organisation. We're one of the 3 new PROs. 4 current Crown Research Institutes have been merged. Another 2 are being merged into another PRO. And I heard someone, a colleague told me a couple of weeks ago that ESR was the forgotten CRI. I said, well, we may be forgotten, but we're also the only one that's going to become our own standalone PRO in the new environment. So we're that important. Our work's in infectious disease surveillance and forensics. So what's happening with that change is, and Cleona's emphasised this, and I really want to put these things out there because they're important for our discussion. The funding environment is going to be more challenging, and the government's signalled a really clear focus on economic growth and economic resilience. So we need to be mindful of that. The second thing is that it creates uncertainty for our people. So we need to be thinking about how do we make sure our people, particularly our early career researchers and our researchers who may be looking at opportunities overseas if the funding environment in Aotearoa and around the Pacific, which is already pretty challenging, if it becomes even more challenging. I dare say there may be researchers in American universities who might be looking to come here, but we'll still need to have funding for their research. The other thing is there's a really strong expectations, and we're feeling it as Crown Research Institutes, of much stronger partnerships across universities and between the public research organisations and universities. We need to be just much better at working together and taking an NZ Inc. approach to our research. The fourth thing is priorities, and Cleona mentioned this. The government's signalling its priorities really clearly. And what's not a priority? And I'm going to ask a question of you, Donald, so you might want to just start thinking about it. This, and anyone can respond to this, is about this de-emphasising of social science. And I want to just give a shout out to the Vice-Chancellor of Victoria University of Wellington, Nick, who's originally from this university, because every time I've seen him in front of a minister in a range of forums, this is Nick Smith, he has raised this issue and said, I'm an engineer, I do fundamental research, but unless there is social science research which is going to tell us how we implement it effectively and actually generate impact, then that basic research is for naught. So this is a message that politicians and others need to keep hearing. And finally, my final point here is, and this is, I think, something we really need to be all thinking about, is impact. We need to be demonstrating, particularly, and most of our research is publicly funded. It's no longer going to be good enough to finish our journal paper with more research is required, okay? It probably isn't okay now, but it's definitely not going to cut the mustard in future. We are going to have to be able to show this research is it will make a difference, and here is how it will show, and be able to demonstrate a pathway to impact. Now, of course, that's harder with fundamental research, but we should be thinking right up front, even as we're putting our research proposals, and be much clearer about what the impact is going to be. And that doesn't have to be economic growth, but it should at least be able to demonstrate how it's contributing to social, cultural, environmental and economic resilience and well-being in our communities. So a few thoughts there. All right, enough from me. I'm going to start with you, Jemima. You can say whatever you like, of course, in response to my question. That's the beauty. But I know that the area of mental health is one of your key areas, and one of Donald's slides talked about the growing problem of mental health issues in the Pacific, and we know that they're here as well in Aotearoa. And I'm thinking just, any thoughts you've got about how we move from, describing the problem and our understanding the problem and the gap between the size of the problem and the services available, what is it we need to be thinking about that's going to help us really address those issues? You can answer that question, or you can say whatever you plan to say with your opening comments. Over to you.
Thank you. Taylor, Ashley, and happy Samoan Language Week, everyone. That's loaded, but I can probably only respond in light of what you've just presented, and it's pleasing to see that Fiona, you presented that it's still a government priority, mental health and addictions and suicide prevention. So that's somewhat pleasing. I think it has to be a whole lot more intentional in terms of what mental health and addictions and well-being means, not just New Zealanders, but Pacific peoples, because then I think you can hone in on what really matters to us and what impact that will have for our communities. We know that suicide ideation, deliberate self-harm, and obviously suicide deaths have a huge impact on our Pasifika communities, as well as tangata whenua, who embarrassingly have the highest rates of suicide deaths in OECD countries. And of course all of that has spin-off effects, in that even as a country we are not readily prepared to service the needs, the mental health needs of our communities, diverse as they may be. And then of course the Pacific, twice if not thrice worse off. And it's concerning because it really does impact who we are as beings, our spirituality, our physical, the holistic nature of our being. And so it's amazing that Sir Colin and Poutoko Ora Kiwa are leading, I think, some mental health surveys in the Pacific, which haven't been done for a very, very long time. And in this country, the last national survey we had around mental health was 2006. So there's so much work to be done. And then you spoke about social sciences and humanities. If we don't apply that lens to mental health and well-being and addictions, then we completely miss the mark on so much critical data and information. And then one more thing, sorry, very long-winded, being prepared for that generation of AI. We need to be ready as Pasifika communities, otherwise the inequity will just widen.
Yeah. Thanks very much. Some really astute observations there. This is a challenge, and it's not unique to New Zealand either. And as you've said, and this session is about both, Pacifica and Aotearoa, but also in the Pacific, and it's great we've got Donald and Iona here to speak. I want to come to you, Dame Tuila, and you've got some things you want to say, that's great, but and in addition to that, maybe just, this may be a theme of what you're going to talk to, a real challenge at the moment is how we keep equity on the agenda, and one of the ways to do that maybe is not to use that word, because it's actually a flash word for fairness. And actually fairness is a fundamental principle of this country, and it's something, a fair go is a real, fairness is a fundamental principle of our health system and indeed our country. I was struck when I got in my inbox from colleagues 2 weeks ago, the rheumatic fever data from 2024. 204 cases of acute and recurrent rheumatic fever in Aotearoa in 2024. Highest number in 10 years. 95% were Māori in Pacifica. Doesn't sound fair to me, and there must be something going on. At that same time, we've had quite a focus on trying to reduce the impact of rheumatic fever, reduce the incidence, and provide better treatment. It's an example, I think, of those ongoing inequities. And also, I think, the importance of us really challenging ourselves. If what we've been doing hasn't made a difference, then we've got to really look at ourselves and think about what we might do differently. So, Dame Tuila, I'm interested in your thoughts on anything you want to speak about, but just picking up perhaps that theme of equity.
I mean, the other thing with rheumatic fever is where I work in South Auckland, half of the... Can you hear me now? Half of the cases of rheumatic fever are in South Auckland. And I think we do the science and we kind of know what to do, but we never implement anything. So the school-based echo screening pilots aren't in South Auckland. They're somewhere else. Why is that? I don't know why. I don't know who makes these decisions. So how do we keep the focus on equity? There's decades of we're still doing the same thing.
We'll just turn the volume up here. Tell you what, in the meantime, seems to be...
Decades of injustice and poor outcomes, and our death rates in Pacific children are 2 or 3 times that of Pākehās, and it hasn't changed. And it's very disappointing, isn't it? And I acknowledge my fellow paediatricians in the audience that we keep seeing the same things. And we know, the science tells us that we need to be focusing on the things the wonderful Corina spoke of, our environment and those determinants. And that's difficult to do that when we have policy and agendas that are set by politicians who don't necessarily trust our science. So I agree, most of the community trusts science, but we're not necessarily winning that battle. We're not winning it with politicians. And increasingly we're seeing our families come into the hospital, and as you're talking to them, they're looking up ChatGPT and Facebook. So we're getting questioned. It's important that we communicate the science and implement it. I think we have to probably change our language, so I totally agree. We can't do vaccines and smoking cessation, the really big wins in public health, if we don't have social science to help us. But we need to change the name and just call it implementation science or something else, so that it gets over the bar with the current environment. And we're in an environment now where Pacific and Māori are not words that are particularly in favour. So we don't want to measure these things, and we don't necessarily want Pacific-focused programs. So again, we just have to pivot and call it something else. Still keep measuring, do that anyway. We have to do that, Corina. But we have to call it community. Call it community. Just give it another name, do the same thing. That's my view.
Thanks, Dame Tuila. We do need to be flexible, and we've been here before. And as our colleague Paparangi Reid said, the tide goes out, but it does come back in. And of course, we need to be making sure we're keeping doing the good mahi and not losing sight of the importance of these things. So I just do want to acknowledge the amazing work you and your colleagues do in South Auckland with both rheumatic fever and other Iono, tell us what's happening in Samoa. There's a nice open question. I think you've had a bit of a focus, including trying to get your ministry a bit more focused on research for Samoa. Over to you.
Thank you very much. Happy Samoan Language Week. I'm indeed privileged to be invited to this forum and also this panel. Now, research evidence is important for New Zealand for planning, for strategy, and also for improving clinical outcomes. And so it's more equally important also for the Pacific Island countries, the small countries in the Pacific. Now, there's probably more research being conducted in Fiji because they've got more research in university institutions, and in Papua New Guinea, whereby there's also government-funded research institutions. But in the small Pacific Island countries, most of them do not have the population, the HR, human resource, limited funding for research, and so therefore, and also limited systems for research. I know of one year where the research was going very well in Tonga, and then you just have to have one person leave the system, and then the whole research system collapses because, you know, one or two key researchers in a system actually drives it. But once they leave, then it goes. So therefore, the next best thing is to train our clinicians. There's more clinicians out there in the Pacific Islands, doctors and nurses and midwives, who could be trained to actually conduct research. But we found in a study that was conducted about 13 years ago through the Pacific Society for Reproductive Health that training clinicians to perform research was essential, and that was through workshops that were conducted in the region. We found that only those who were associated with academic institutions and heads of departments, doctors, were more successful in doing research. All the others were not successful, despite the similar training that was given to all the teams. So therefore, if we're going to invest in research, clinical research in Pacific Island countries, then it seems that we need to train more heads of departments, consultants, specialists, and or have them associated with an academic institution, a university. Because when you're associated with a university, you tend to do more research because it's in your job description. We know that clinicians are very busy in the Pacific. You know, many patients to see, and yet Corina has shown, of course, the ratio of doctors per population ratio is very low. So they're extremely busy, and so there's basically very little time for research. And again, research evidence and collection of data is important to actually inform policy and to improve clinical practice. So what we've looked at is to actually encourage nurses and doctors to do clinical audits. It's part of clinical governance. And when they perform clinical audits, and as you know, it can be quick to do a clinical audit than compared to doing research. And it's also cheaper. And using the data that they collect every day. And so therefore, when they do clinical audits, then they can actually improve clinical outcomes almost immediately. But we need to enable them, of course, with better resourcing and an encouragement from the system that is there. So the Ministry of Health in Samoa, the only department that actually puts out more research in the ministry is the Department of ENT, ear, nose and throat. And the reason why that is because there's an audiologist that is there from Australia with a PhD that actually drives the research within that department. And so what I've actually encouraged now is for the Public Service Commission to actually employ her as our lead researcher in the ministry. And then she can go around and actually encourage all the clinicians and heads of departments with the data that they collect every day to actually do more research. So that's how one can actually drive research within the ministry, is to identify key people with research skills and give them the time and give them a good salary, give them space to actually encourage clinicians to do research. So I think that that's the only way to do it. And again, encourage our nurses and our midwives to work in teams, because as you know, research is a team effort. And so therefore, when a whole department does research, including all the nurses and the midwives and the doctors, then it tends to be more successful, especially if it's driven by a clinical leader. Thank you very much for my time.
Thanks, Iono, and you've emphasised a really important point, that is both the value of research for the clinicians in terms of their enjoyment of their work, but of course as well in terms of improving clinical outcomes. I think you've given a really nice description, and congratulations on what you're doing in Samoa. Donald, I want to come to you. Thanks for an excellent presentation this morning. You've been writing some notes, so feel free to tell us what else is on your mind following the other presentations you've. And I just wonder if this issue around sort of with implementation science happening in Fiji or in some of your efforts, but also just please any reflections you've got before we go to Karina and then open up for questions.
Thanks, Sir Ashley, and again thank you to Sir Colin for the invitation. Really honoured to be sitting among panelists lined up here. The Fiji Institute of, I'll talk mostly from Fiji, but we do engage with a lot of regional countries as far as our research is concerned. We collaborate a lot with our Pacific Island countries. The Fiji Institute of Pacific Health Research was established in 2019 with a 5-year strategic plan, and that strategic plan was built on the back of most of these regional engagements that we had. And over these meetings, sometimes random, sometimes regional meetings that happen in Fiji, where we get to discuss and try and arrive at what we think are research priorities for those countries. And so in our strategic plan was a list of about 10 strategic themes along which we aligned and made them the research priorities. So I think we all know that non-communicable diseases make up the bulk. In Fiji's case, the top 4 causes of morbidity and mortality are non-communicable diseases, and the same, I think, across most of the Pacific. One of the things I should probably add in here is that childhood obesity is also increasing across the Pacific. So while we're dealing with adults and who we think are very resistant in our attempts, to deal with the NCD problem, we need to look to the next generation. But the childhood obesity problem is also probably becoming a crisis, and so we really need to invest a lot of those resources into ensuring that the programs in schools, the policies, canteen policies, food policies for children, whether we're looking at sugar sweetened beverages, taxations, and things like that connect to children are important. The next thing I think is in terms of priorities is probably infectious diseases. I think a number of our countries continue to be endemic for leptospirosis, typhoid, dengue, and diarrheal diseases, particularly in the informal settlements. And we have a number of projects that are currently running, looking at, so particularly informal settlements where everything is informal, and so, water supply people come in tonight, they set up house tonight, tomorrow morning they connect to the pipe water from the neighbor, electricity is running by tomorrow because everything is informal and illegal. But so a lot of when that happens, it rains heavily. When it rains, floodwaters come up, and because of the toilet system, so they would have either a pit toilet system or a water seal toilet system. Waters come up, all of the fecal material comes up, settles again on the ground when it goes down, and children are running around barefoot on. So that happens, that cycle continues. And so a lot of drinking water in informal settlements is almost always contaminated with fecal material. And so diarrheal disease is really very prevalent in these informal settlements. And so these projects are really trying to see what are some nature-based solutions to try and solve the drinking water problem in these communities. The last slide that I showed in my presentation was talking about the HIV crisis in Fiji. And I did talk about that spike happening particularly last year, and I think it was after September, from January to September. I should say that maybe 80% of that number of HIV positive tested people last year, 80% of them are injecting drug users. And so this crisis is really driven by the new habit, the injecting drug use in Fiji. And I think one of the saddest things is that the youngest HIV positive is a 12-year-old boy who's never had sex. So he got HIV positive by the sharing of needles. So all of these habits are really, it's the blood sharing. I'm not sure if you've heard about Bluetoothing, if you've heard about chemsex, but a lot of these things happening among our people. So someone would get a drug, and we just finished this collaborative study with the UNSW, working with sex workers, working with some drug dealers and drug pushers. We needed to make sure that the police weren't in the room, but it's just amazing to see the extent of the problem. While the police are dealing with the mechanism of how drugs get into the country, we've got to work with the people. And I think in our context and in our culture, in our religion, when we talk about what's successful in other countries, which are primarily needle and syringe programs, this is a really very sensitive sort of discussion to have, because the first thing they'll say is that's promoting the drug habit. And so I'll end with what I think Sir Ashley started off with, trust. The issue of trust is really important. We're fortunate to have been funded by DFAT for a national sero survey, for which we were also able to build a container lab. Something I think that our Pacific Island countries lack in is just the capacity, both human capacity and infrastructural capacity. At the back of COVID, the peak of COVID, our permanent secretary and head of health protection used to make these TV conferences at the news conference every evening and say, okay, today we collected 18,000 samples to be tested. 10,000 were processed at the Fiji CDC, 8,000 needed to be shipped off to Melbourne. At that point, I thought, so we don't have the capacity to be able to do this for our country. But even us as the national university didn't have the capacity either. And so we really needed to look around, and at some point we need to also be able to respond to that in the country. So now we've finished the sero survey. We've got 4,000 samples in the freezers, and we've been able to do the testing completed. We've also used the same aliquots to do some dengue sero surveying, which I think is very helpful. But now is taking the results back to the communities, and the trust issue comes in. So when Fiji's first dose of the COVID vaccination reached about, not the first dose, the second dose, reached about 40%, we saw that the uptake started tapering off. And this is at the time when the misinformation and disinformation really started on social media. And so that started plateauing off. And so now when we've got these results, we've got to go back to the communities, to the individuals and to the communities and present the results. Broad results are basically that 97% of our population are antibody positive. So the difficulty is going to certain people, and you get the question, I did not want to be tested. I did not want to get the vaccine. Why is it that I'm positive? And so getting this conversation happening at a very community level, I think, is important, especially for things like COVID that became so political globally that we really need to continue to engage the trust of our people in conversations like that. I'll end there. Thank you.
Thank you, Donald. That's a wonderful overview and a very sobering statistic around that HIV outbreak you've got, or epidemic you've got, which is entirely preventable. And it just reminded me of the amazing work 40 years ago that some of our key public health people did here in this country so that HIV did not get established in our injecting drug user population, and still isn't. And obviously the role of very simple, very cost-effective needle exchange schemes and supporting that, and exactly the same issues, of course, about this tension between those on the law enforcement side and those on the harm reduction public health side, and I would see those play out in my work. But now a really strong sense of agreement around that. So a lot of work to do, and as you say, fundamental is building trust and understanding in the community. It won't happen overnight. It will take time. Karina, I just want to say it's wonderful that you are in the role you are in, as Director of Public Health. Most of you will know that this is a role that Colin was in over 20 years ago. So I call that fantastic long-term succession planning. A 20-year view of succession planning. So well done, Colin. You can take some reflected glory just while the helicopter flies over. Anything else you want to add, or any observations from you before we then open up for questions from the audience? Over to you.
Thanks, Ashley. I feel like I was really greedy. I already had half an hour to speak. But what I do want to say is I think the most important thing we can do is support our communities, kind of listen to what matters most to them. What are the issues happening in our communities? How can we support our communities to implement the solutions that they already have? And also, just really want to say it's so fantastic to see so many familiar faces. I see lots of people who have been championing Pacific Health for a very long time, and lots of emerging Pacific researchers. So it makes me feel really hopeful.
Good.
And I know you want to end on hope, and it does. It makes me feel extremely hopeful to see all these amazing Pacific researchers. I'm really looking forward to the sessions this afternoon.
Wonderful. Okay, if you do have a question, please put your hand up and we will get a microphone to you. You won't need to shout your question. There's one down the back there. Thanks, JP, or someone will take that there. The comments you made about listening and building trust, I mean, one of the things that came out of that survey in New Zealand about trust in science and scientists, and high level of trust in scientists to lead the discussion about introduction of new technologies. In that survey and in the global one, the area where scientists didn't score so highly was people were not sure that they would listen to them very well. And there were two simple requests. Tell us the pluses and the minuses, the pros and the cons, and secondly, listen to us and hear our concerns. High trust, but really wanting also to feel they were being listened to. So I think there was something in that. Right, we've got a question down the back, please.
Thanks very much. Stephen Howie, one of the paediatricians that James Wheeler was mentioning, so Kiwa Tato. Now, I wanted to pick up on the point that, actually you were making about how crucial partnership is. And this is a wonderful panel. And I would love to have, and I know this panel will have views on this question, and I would love to hear your candid views on what is working and what is not working in partnership in health research in the region and for Pacifica.
Thank you very much. Such an excellent question. Iona's thrust his hand. It is right. Okay. Well, anyone can respond, but you start off, please, Iona.
Thank you very much, and thank you, Steve, for that question. And it's one of the things I missed actually in my presentation, is that one of the key drivers for increasing research volume in the Pacific is collaboration, or the partnership that you mentioned. Collaboration. So there's a lot of you who have come across, and Steve is one of them, come across the Pacific to Samoa to seek collaboration with our teams. Now, of course, we don't have research teams to collaborate with you, but our ministry would be very happy really to have our key people talk to the researchers that come across. Like, for example, Massey University was there last week, and I assigned one of our people to collaborate with Massey University with whatever research that they wanted to collaborate with. So one of the key universities that actually collaborated very well with Samoa, and mind you that Otago has been there, or Auckland has been there, is Yale University from the United States. So Yale University came about 10 years ago, and they brought funding and equipment and grants from the United States. So they employed local people to actually do the research. They trained those people. And so as a result, they've got more than 15 PhDs and tons of publications from research they've actually conducted in Samoa. And so therefore that's, and the volume of research that we conducted in Samoa by the Yale team is just amazing, and including some of the genetic type research. And I think they collaborated also with Auckland University. I see that Offa is here with some of that research as well. So collaboration is actually key in improving research in the Pacific. Thank you.
Thanks. Tuila, over to you. What's working and what's not working?
I just wanted to, first of all, acknowledge the wonderful Sitaleki Finau, who gave us that wonderful paper, Research Imperialism, which tells us what not to do, which is years and years of external researchers going into the Pacific and researching on us. And, that lesson that Sitaleki has left us and taught us is really important not to forget. What works, I think, in addition to what Iona said, is clinician collaboration. So building clinicians who work together in New Zealand and Australia and in the Pacific. We can do RCTs together. We can work on how best to treat sepsis together, and we can also, share webinars. But I think that clinician collegiate relationship is really important. And alongside that, here in Auckland, we really want to support our colleagues to come here and take on an academic qualification, do a PhD or a master's, and that once you have that, it builds your capacity and interest to carry on with research in the Pacific. So collaboration with colleagues.
Great point, and I can just hear and see Sitaleki telling us that. I'm sure many of you can as well. A great memory. Any of the other panellists want to comment before I take the next question? No? Okay, let's go. We have a question down the back, please.
Thank you very much for the beautiful presentations, and I think we are so privileged to have all the expertise in the fields. My question is, I wonder if we can be more transformational than we are at the moment, because we are very good in collecting information and analyzing the problem to death, but we still see the same trends. Because some of the things that I hear are something that I heard 40 years ago. The Pacific people are like this, and Pacific people are like that. I'm not heavily I understand. I'm in Pacific. I understand what we talk about. But I'm just wondering, whether we miss something in our research, or we can have a re-look at how we do things. I can't help thinking about this movie, Patchy Adams, where he had an alternative way of looking at the world. And I don't know how what kind of issues that we do. Let me give you just a quick example. I mark a number of papers that were looking at pre-diabetes among the Pacific. And some of those were actually in the context of the churches. And they played almost everything except the church. The practice of the church, I thought we have a lot of far around in the church, why don't you talk about it? Because sometimes, is it really, maybe our culture, we love our culture, but could that be the key problem here? Has anybody ever looked at that? How can we come back in 3 years' time, 5 years' time, and talk about great stories that we see, transform the Pacific, and tell good stories, and they're probably great stories
Thank you. An excellent point. I think there's a question in there, or at least something to respond to. The thing I'd like to pick up on is it's not just an analysis of what the problems might be and where the source of that might be, but what's the latent energy and culture in there, and how could that be harnessed, actually? And to be honest, we saw this through COVID, because it was very often the Pacific communities in this country, in this city, that got affected first. And by goodness me, they were amazing at responding and leveraging their strength, actually, including through the churches, to respond and look after each other. So I guess it's if there is a question in here or a challenge, it's how do we shift the narrative across to really focus on harnessing those things that could be a weakness and part of the problem, to make sure they are absolutely front and centre in the solution. Any of our panellists want to comment? Yeah, Donald, please.
Thank you. From an academic institution perspective, so of course at FNU, at the College of Medicine, we have about 80 to 100 students enrolled in any of the master's programs. We graduate about 30 to 40 in the Masters in Medicine, so the clinical masters. But across the Pacific, and we form 15% of the population of students, 15% of our student population are from the region across the Pacific. So the regional students are strongly encouraged to do research in their countries, identify what the problems are in their countries and do research in that. But that's at the master's level. But we also have, I think, a program that's been really successful across the Pacific, and it's a postgraduate certificate program that's facilitated or that's delivered by SPC and PHOA in the North Pacific countries, but FNU confers the award, and it's the postgraduate certificate in field epidemiology. I'll give you an example. So those who are recruited many of them are people, let's say, data clerks or people who've worked for many years, but they don't have formal qualifications. But it's the recognition of prior learning by having worked for so many years. In the Federated States of Micronesia, several years ago, one of them, so there were about 16 students. So part of the training is an operational research project, and so this person went to a primary school, looked at the school health programs, and saw that they didn't have a hearing assessment as part of the school health program. So she wrote that up as her little project, and that ended up in Parliament of FSM, and it changed the school health program policy. So I think in terms of transformation, I think it can happen at many different levels. I think the question around transformative research, we can impact policy and changes, clinical guidelines and protocols. I know that one ophthalmologist who was my student who did the master's degree really changed how many days a person should come to clinic after a certain eye operation versus what was in the clinical protocol. And so some of those things can happen. I think in the region it happens very slowly, progressively, again, depending on, as long as I think we're able to build the capacity of the people, retaining the capacity within the country so that continues. And I think if we have that plan in place, it helps continue building the capacity.
Thanks, Donald, and a great example there of that research influencing then actually policy and practice. And I'd encourage all of you who are researchers to not to think about your relationships and your networks and your partnerships, to include those working in the ministries and so on. You've got someone here in the Ministry of Health or Public Health Agency who's sitting here, so leverage those networks. Just establishing the relationships. You might not need it today, but you might in 5 years' time be able to really be at the right place at the right time and influence something quite profound. Now we've got a question over here. If we could give this chap the microphone, please, sir.
Thank you. I love the support. I love this so far. Potentially a big question here. One is that I don't think it'll be here all day. But I'd just like to hear your thoughts, because you're all involved in various kind of avenues of research. Do you think that trauma in all of its various forms is something that's like understudied? And what are your thoughts on that? What might be happening in the way of that? Because we know the extent like how burdens are people's with regard to all the chronic medical diseases and so forth. So we'll start with trauma has a yes, it is
excellent question. Jemima, please.
Yeah, thanks for the question. As you said, trauma in all its forms, absolutely it is, and it's not necessarily something that Pasifika or any human is comfortable about airing. You could look at SA or sexual violence, you could look at physical trauma, the psychological trauma, spiritual trauma even. And as part I know this was going some time back in 2018 as part of the Mental Health and Addictions Inquiry, trauma was basically the core of everyone's challenges in this country, regardless of ethnicity, age, location. It was trauma. But if we take that a step further, it may be able to dismantle a lot of the health research that we could potentially investigate, and that is historical trauma, the discrimination and prejudice of dispossession of land, race, institutional racism, gendered violence, so much. But how, I guess the next step in terms of the research priority around or strategy is how do we best address that trauma that makes sense to us and is more impactful, rather than applying certain lenses that blanket something that is so complex for much of our population. So, in short answer to your question, yes, we need more trauma-informed investigations.
One of my jobs is I work in ED, and it's an increasing frustration of mine that we see young people coming in all the time with mental distress, and our response to them is, oh yeah, you're not suicidal, you haven't got a major disorder, off you go, pat them on the head and away they go. And so our ability to not only clarify what's happening in terms of mental distress and trauma, but responding to it is just such a frustration. Yesterday, actually, I was looking online at trying to find an AI app that could do CBT and like mindfulness, that was free, that I could refer people to, because there's just such an absence of trying to get help for people. So it's a big frustration for me. Absolutely, we need to do so much.
Thanks to you both. So a great question, and I think some really incisive response of there. We've got a question down the back here, please.
It's going to be very short. Regarding Pacific data, do you have any specific data on the different islands? Because we are here as Longmans, Taiwan, Fiji, and so on.
Okay, so two elements to that, I'm sure, both in Aotearoa, but also maybe Donald and I may be able to comment on the state of data about health and in the different Pacific Islands as well. But Karina, to you first.
As soon as I saw Seta, I knew she was going to ask that question. She asks that every single time. Thank you for your question. Absolutely, we need ethnic-specific data. It's quite hard to get, actually, and it's becoming increasingly complex because we know that 40% of all Pacific people identify with more than one ethnicity, and that's more than half of Pacific children under the age of 15 identify with multiple ethnicities. I know when I was at the Ministry for Pacific Peoples, we were doing a long-term insights briefing specifically looking at Pacific people who also whakapapa Māori, and a third of all Pacific children also have Māori whakapapa. So absolutely, totally agree. I was like, I should have included a slide with ethnic-specific data as soon as I saw you. But we also have to grapple with the increasingly complex identity of what it means to be Pacific, because ethnicity is just one dimension of identity, and it's becoming increasingly complex.
Thank you. Donald, did you want to comment?
I was just thinking, it's amazing what politics does. Until we had our elections 4 years ago, I think. Before that, for 16 years, we were not allowed to receive or to get ethnicity disaggregated data because it was called racism, racist. Change of government, bang, we're allowed to do that. we have elections next year. I don't know what's going to happen next year, but it is such, I've had this argument with so many people. Ethnicity is a biological determinant of health. There's a reason why Africans are predisposed to certain blood disorders. It's because they're African. And, you know, so it's difficult, but it's a conversation I think that needs to continue to happen. This access to data in Fiji, I think we've evolved pretty much over the years, but I think we hear at the Pacific Heads of Health meeting how it's usually quite difficult to get really disaggregated or broken down data on many aspects.
Thanks, Donald. We've got a question up here. Thank you for your question. Come back here and ask one. Keep asking it. It's important.
My question is social responsibilities of the researchers who are specific people. You come, you take. What is your responsibility in terms of coming back to us and tell us about your next step of how your research will enhance our health? Because looking at the stats here, it seems like we're not moving. And that's my question, is about the trust. Because we know in the community that researchers are so good at taking things from us, taking our stories, but also the other questions about the narratives. You take it, and who writes the narratives for you, where you found a way, and I'm interested. Did you really capture my story? So it's social and moral responsibilities of researchers to us as a community.
Yes, I agree. And I'm sure our panellists would like to comment as well. Please, Toila.
I totally agree with you, and I think the hope on the horizon is that we have researchers who are now in the community, working where the community leads the way. So there is story sovereignty, and not all the time, but there are researchers who work in that, I think, ethically correct and a way that's likely to bring that transformational change, which is partner with the community. Don't just take your research off to the university, but you're in the community with people and you're doing research with them. So their PI is on the paper, same as everybody else. So I think partnering with the community is really critical.
Just to add to that, quickly, just first-hand experience, I'm doing a project which is looking at the nexus between climate change and mental health and well-being in the Cook Islands here and Niue. I'm not Cook Islands, I don't whakapapa Cook Islands or Niue, but it was important to the research team to attempt to grow a pipeline of researchers in Niue in the Cook Islands. Obviously, in those countries, they are probably on 10 research projects. And so the process is rather slow. So with that data, I don't profess to not oversee it or curate it at all. It is the communities we work with, it belongs to them. So in time and more communication and more, as you say, going to and fro, that data will become more available. But I think as senior researchers in the room, we need to be very purposeful and intentional about growing the pipeline and not feeling so insecure that perhaps your job may be on the line, because that's not what it's about. It's about thriving environments and new ideas and innovation and elevating our young people.
Thank you very much. Actually, we yeah.
But we need to look at outcomes for our Pacific people.
Wonderful, and I think that's a great point for us to finish on, and your comments, and Jemima, your comments about the pipeline, about outcomes, impact, always remembering who the research is for, and it's not for the researchers, it's not for academic citations or getting promoted through the ranks. We need to draw the session to a close, but our panellists will be here for lunch, which we can hear we heard brought in, we can see it and we can increasingly smell it. So I'd like to thank all those who did ask questions and who participated in the session. I said we'd finish on hope, and Karina's already raised this. So there's a wonderful article in the Harvard Business Review last December about hope. Hope is an active thing. It's not something you put under the cushion on the sofa and just sit on or look at on the mantelpiece. Hope is optimism plus a plan. So I'd love you to just think about what your plan is. If we are to be hopeful, regardless of what the statistics show, actually, where's the plan about how we take Pacific research to the next level, both here in Aotearoa and, of course, across the Pacific, drawing on those partnerships, drawing on strengths, growing the pipeline, increasing the impact for our communities and working always with those communities to make sure that we close the loop with them. So thank you very much, and I'd love you to all just join me in thanking our panellists, and then I think JP will give us instructions.
Oh, there we go. I should turn it on. Malo Bidosu Ashley, thank you very much for facilitating that session. For a moment it got a bit intense. I thought someone was going to run it straight. But we're now going to break now for lunch. But before that, we've got some gifts for you, sir. We've got Moana Pacifica lifetime membership, especially for you, Don, don't support Dan Rua. So we've got some gifts here, and for everyone else, it's a stickman painting that I did also on my way in this morning. So a round of applause and thanking our wonderful panel. I do apologise, we are short on time.